Hello everyone, and welcome to this audio podcast. This audio podcast is part of the syndicate. This audio podcast is part of the Bostic Syndicate. This audio podcast as part of a Storm and Saga analysis, and this audio podcast as part of the Squallish Series or edition, and this audio podcast is part of a Storm and the Bostics production. Today, looking in at around renal and psychology aspects in aligned to renal and psychology in as part of this audio podcast. So to start off with looking at sort of screening strategies. So two potential strategies for screening, for example, symptomologies around anxiety in recipients with CKD and or ESKD or ESRD have been evidenced in amongst the literature. So initially, a conservative approach, a conservative basis to screen recipients with signs of anxiety or related health, and these particular signs include in around social isolation, withdrawal, for example, from family and friends, and in around social gatherings, and changes in sort of physical functioning, and or increasing physical sort of complaints in around sleep, for example, in around resting or sleep disturbances, decreased sort of self-care, including poor compliance in around pharmacotherapeutics follow-up, and in and around for example, KRT and RRT. Excuse me. It is more secondly, it is more aggressive. It is a more sort of aggressive strategy to screen all a new CKD and ESRD or ESKD recipients periodically, for anxiety, implementing screening sort of surveys or questionnaires. Additionally, in around screening, recipients who screen positive, for example, in around anxiety, should be referred to a qualified healthcare professional to confirm sort of diagnosis or diagnoses with a clinical aligned with a clinical questioning or interview. Secondly, or additionally, recipients who require immediate referral to healthcare professionals or emergency services. Services include those with suicidal ideation, for example, and and or intent, and those with anxiety complicated by psychosis or psychoses, and or condition in around mania. In as part of diagnosis, and the gold standard to diagnose anxiety-related is through clinical questioning, clinical interviews surrounding the following. So initially, in around a structured clinical or questioning in around the DSM disorders, DSM conditions or disorders. Secondly, the sort of composite international diagnostic interview, and then the mini international neuropsychiatric interview, and then self-reported questionnaires such as patient health questionnaire, PHQ-9, Beck Depression Inventory, BDI, and Center for Epidemiological Studies in around depression, a quick inventory of depressive symptomology and self-report, or the QIDS SR. Anxiety and CKD, anxiety is and has been evidenced as sort of prevalent in recipients with CKD and or ESRD or ESKD. The prevalence of anxiety, for example, versus other sort of relating or regarding sort of symptomologies is 3 to 4 times higher in recipients with CKD and or ESRD or ESKD compared with the general population, and 2 to 3 times higher compared to individuals with higher chronic illnesses, chronic illnesses or chronic conditions. In around anxiety and outcomes, the majority of studies in recipients with ESRD or ESKD have reported an association between anxiety and poor psychosocial and medical outcomes. In addition to mortality, anxiety in patients or recipients with ESRD or ESKD has been significantly associated or has been associated with other adverse sort of outcomes, including in emergency department visits, hospitalizations, cumulative hospital days, and sort of withdrawal from RRT or KRT, and additionally suicide. Anxiety has also been associated with poor psychosocial outcomes in patients or recipients with ESRD or ESKD. Higher symptomologies are associated with lower QOL or quality of life. As part of the mechanistics of anxiety, around the mechanistics or part of the mechanistics of anxiety, challenges associated with RRT or KRT, such as traveling to KRT or RRT sort of clinics or performing routine KRT or RRT is and has been evidenced in amongst literature. Functional impairment and physical symptomologies caused by chronic illness may also contribute to the development of anxiety. And then additionally, the psychological burden of having the condition can affect more in around morbidity and mortality, and where may lead to further anxiety. In around anxiety and where in the literature there are terminology referred to as panic syndrome. So extreme anxiety and somatic symptoms such as breathlessness, palpitations, chest pains, sweating or perspiring, and fear of dying can occur in renal cases. And the process of KRT or RRT and a multitude of potential medical complications give a patient or a recipient can give recipients or patients a lot to worry about. Pharmacological or pharmacotherapeutics management is and has been evidenced as being important in the management of anxiety, particularly in around anxiety, more so than panic. Many recipients with anxiety also tend to experience insomnia, and then as part of healthcare, in recipients with conditions with long-standing or long-term conditions, treatment with particular pharmacotherapeutics significantly can improve symptomologies and psychosocial outcomes. Recipients suffering from renal insufficiency can often present with unusual psychological issues or concerns, where treatment modalities vary on an individualized basis, and pharmacotherapeutic treatments, and in line to the use of pharmacotherapeutics. A wide or broad variety of pharmacotherapeutics have been in amongst the have been evidence in amongst the literature for the management of anxiety, and each of these may have a different effects, but most are safe in a large number of cases. As part of health related quality of life, or HRQL. It has been considered as a good indicator of physical and psychological or psychosocial well-being in amongst varying chronic illnesses. Excuse me, and also a strong sort of predictor of morbidity and mortality. The concept of quality of life covers psychological well-being, containing the sort of cognitive component that refers to the overall state of satisfaction, and the effective component. Excuse me. And finally, as part of this audio podcast, a quick look at coping, looking at coping. So coping is a response mechanism used to regulate the effect of different types of stresses on physiological responses, but additionally in around psychological triggers. Evidence of coping strategies implemented in amongst populations with and across different conditions, different healthcare conditions, could help and can help explain differences in disease in prognoses and survival rates, and ability to adjust to challenges experienced while living in amongst populations living with chronic illnesses or chronic conditions. Additionally, and finally, optimism may have a direct physiological effect on the around the neuroendocrine system, and on immunology or immune responses, and an indirect effect on health outcomes by promoting protective healthcare attitudes, and adapting coping strategies, and enhancing positive attitudes. That draws this audio podcast to a close. This audio podcast as part of the syndicate. This audio podcast as part of a Bostic syndicate. This audio podcast as part of a Storm and Saga analysis. This audio podcast as part of the Squallish Series or edition. This audio podcast part of a Storm Lobostics production.